Health is bracing for what could stretch resources even more. As students head back to school in Coeur d'Alene, the hospital expects to see more children come in with COVID-19. Thanks for staying up with Nightside. I'm Aaron Luna. The hospital doesn't have a pediatric ICU, meaning if a child needs extra care, they'll have to go somewhere else. Kootenai Health says there aren't enough beds in the region for what they expect to see in the coming months. New on Nightside, Caitlin Knapp explains what Kootenai Health is anticipating specifically from Coeur d'Alene Public Schools.
Today, 95 people are at Kootenai Health with COVID-19. 32 are in critical care. The hospital expects more people to come in, specifically children. There's a plan in place for the potential surge, though it doesn't make the concerns less urgent. In less than a week, Coeur d'Alene Public School students head back to class. Right now, masks will not be required.
COVID is here, and we have seen it and have cared for it.
Kootenai Health is bracing for a rise in hospitalized children. Out of the 11,000 students in the school district, 6,000 are in middle and high schools. However, Kootenai Health says only about 1,000 are vaccinated, leaving Dr. Vanessa Carroll uneasy.
We can anticipate from the Coeur d'Alene School District alone, approximately 200 children will require hospitalization for COVID.
She believes, based on national trends, 60 will need to go to an intensive care unit. The hospital doesn't have one for kids. The number of pediatric ICU beds across 4 other hospitals in the region aren't enough.
If we add up the available beds, based on the current projections, we don't have enough beds to even care for the Coeur d'Alene School District with COVID that require hospitalization, much less Kootenai County.
Even if they have the beds, there may not be enough nurses to help. So what's the plan for this anticipated influx? They're reallocating space to prepare to increase bed capacity and have started refresher training on ventilators.
We're in constant communication with our outpatient pediatric partners so that they know what we're seeing and we're aware of what's going on in the community so that we can operate in partnership.
Other care guidelines are in place as they prepare for what they hope doesn't happen. Caitlin Knapp, 4 News Nightside.